Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Good morning, everyone. This is AARP, Arizona Hispanic Connection. And as I always say it, this is going to be a special show. And I suppose all of our shows are special because of the issues that we address. Today, the name of the show is Navigating Healthcare from Preventive to Hospice. You know, believe it or not, I spend a good amount of time and then I ask people whether these subjects or titles are appropriate. And that's why these subjects, I love them because they're not just mine. It is the fruit of several people that get involved, and I really like it. I believe healthcare is an amazing subject. I believe it's critical that we understand what it is, what it isn't, and more than anything, we need to learn how to navigate it because it's extremely complicated. So we have, as we always do, great experts today. And because the subject is so intense and so broad and big, I'm just going to go straight to the issue. And I would like to ask you to introduce yourself. Give us your name and just who you work for. What do you do? And in just 2-3 words, what concerns you about healthcare?
Thank you, David. Good morning. My name is Suzanne Sanchez, and I work with Hospice of the Valley. I have been fortunate enough to be there for 15 years, actually. Great. So I've been able to serve many facets, both clinical and non-clinical, and currently I'm one of our community liaisons. So my job is to be out and about and get the word out there so people are familiar with Hospice of the Valley and all of our services.
I see MSW. What does that stand for?
That stands for Master of Social Work. So my education is social work, yes.
Great. And what concerns you about healthcare?
You know, I think my biggest concern is that it's constantly changing. And so it is up to us to make sure that the community and people are aware of what they need to know, because we don't know what we don't know. Right. So as long as we give folks the tools that they need in order to advocate for themselves as best as they can, then we're doing our job.
Thank you very much.
Absolutely.
Good morning. My name is Martha Brion Ramirez, and I've been in the medical field for 15 years. I'm a certified professional coder, and my biggest fear right now for health insurance is just that a lot of our people are missing a lot of the good resources that are out there, and just what you guys are doing is great. Just, talking to people and making them aware of everything that they could take advantage of. But I just feel like there's still a big push for that, right. And just providing more information and having them actually understand the information.
Now, you take care of your parents in helping them navigate the system. What is your thoughts or concern about healthcare in general?
Again, they really don't understand the process, difference between co-payments, deductibles, what's out there for free for them, what can they get paid, what can they get help with. I mean, it's something that they don't understand. They didn't get any information from anyone pretty much, but whatever I could provide for them. But yeah, I just feel like we need more people like you guys.
Thank you.
So thank you for inviting me today.
Sure.
Good morning, everyone. I'm Jenny Correa Krieger, and I have a background currently as caregiver for two.
Your mother and your husband.
My
Jenny.
mother and
Wow.
my husband, yeah.
Amazing.
At the same time, so
Yes.
it's simultaneous.
Yes.
My mother is 95. She was 95 in January, and my husband turned 90. So I have two in the 90s, and I have been taking care of them, every time they needed it. And then more lately, that's just ongoing because it is long-term care now for them.
Right.
In my past, I've been a PhD professor at major universities, and I'm also more or less a full-time volunteer with AARP on 3 levels: state, local, and national.
Yes. Yeah, AARP is fortunate enough to have great volunteers, and Dr. Krieger is one of them. She's just amazing. Actually, we were talking about that we've known each other for 15 years. Actually, we pretty much came close to the same time.
We were a package deal.
That's right. Thank you for everything that you do, Jeannie.
And my issue is the movement away from affordability for healthcare. Remembering that healthcare is important your whole life.
Right.
Your whole life.
So not just, it's basically a synonym of health, right? Health and healthcare go together. Yeah, thank you. Dr. Krieger?
Hi, my name is Andrea Parra. I am a Medicare counselor with the State Health Insurance Assistance Program. It's one of the many programs that the Area Agency on Aging offers. We provide free, unbiased, personalized Medicare counseling to Medicare beneficiaries, their caregivers, family members. And one of my biggest concerns right now in regards to healthcare is the cost. Most of the clients that we help, their main concern is I cannot afford my copays for my doctor visits. I cannot afford my medication copays. So that's one of my concerns.
So basically, you take calls. Do you have a number of calls that you do each year? And the Area Agencies on Aging has this SHIP program, and it goes by regions. You basically work for Region 1. What's the volume of calls that you get at the Area Agencies on Aging?
We get a lot, but last open enrollment period, I believe we assisted 3,000, close to 3,000 Medicare beneficiaries. But we help everyone that has a Medicare question. So we not only help the Medicare beneficiary, we get calls from doctors' offices, from the actual plans, from, again, the caregivers, and we help from the beginning to the end. So we not only help in educating how Medicare works, we help with the enrollment. If they have an issue with their plan, we advocate for the Medicare beneficiary, we help them fix the issue. And even if we realize that the plan made a mistake, we also help with the appeal in regards to maybe they didn't cover something. And so we help with everything related to Medicare.
Thank you very much.
Good morning. My name is Jamie Flesher, and I am a registered nurse and a certified geriatric care manager and a certified dementia practitioner. And I am also the owner of Legacy Home Care. We've been in business for nearly 11 years. And we provide assistance with personal care, homemaking, and companionship, caregiving services in the home, as well as geriatric care management and assisted living placement.
Mm-hmm. Great. And let me say to our audience that, and let me read a few concepts that I have here. Healthcare, I got the definition of healthcare, is the maintenance and improvement of physical and mental health, especially through the provision of medical services. And as we know, healthcare involves providers, government, because they need to regulate it, right? Insurance, healthcare is regulated, and we know who regulates it, the government. And the providers are your insurance companies, your doctors, your hospitals, and all the different components, and then the consumer, which is us. So it's like a triangle, right? The providers, the government, and the consumer. We're kind of working, and I'm sure I may be missing a few more components, but roughly that's what it is. It's very much linked to the quality of life and to longevity. You know, how much quality of life you'll have and how many years you're going to live on this earth with quality of life. It'll depend on how you deal with healthcare and how you navigate healthcare. It's very expensive, it's very complicated, and learning to navigate healthcare is a must. We all have to learn to navigate. So that's what we're going to try to do today. We are going to address concepts of healthcare from different angles so that our audience can walk with us, this kind of journey, if you will. And we are going to be talking about care that you will access in different stages of your life or in different conditions of your health. The first concept that I would like to present is that it is very important to understand that most of healthcare, most of it happens in the scope of what is known as acute care versus long-term care. This is a big concept, And I'm going to pause just a little bit, maybe Jamie, maybe Jeannie. If you can just say a little something about these two concepts of acute care versus long-term care. And anybody, but if we can start with you.
Wow, you are right on. There's a lot of misunderstanding between acute care and long-term care. I have a lot of people come to me and say, hey, doesn't Medicare pay for long-term care? And unfortunately, it doesn't. Mm-hmm. Medicare pays for acute care. They pay for hospitalization. They pay for your doctor visits, your primary care. But when you are needing long-term care and assistance at home, attendant care services, Medicare doesn't pay for that. Mm-hmm. Now, if you qualify for Medicaid, Arizona long-term care, that does cover attendant care services, but you have to qualify both medically and financially.
Right. And Jeannie, long-term care is really is not part of the equation in a sense. I mean, Arizona, the Medicaid has a long-term care program called Altex in Arizona. Yes. But other than that, and for that you have to literally be poor. And there is this concept of spending down. That means when you have a lot of money or more money that what would allow you to qualify for Altex, you kind of have to pay cash and then spend down until you become eligible. But Jeannie or Dr. Krieger, in reality, it's not part of the equation, long-term care, correct?
No, long-term care, like Jamie said, is not part of Medicare.
Right.
But I want to go back first to your original point about acute and long-term.
Right.
Acute can occur at any time. Acute is when you need something immediately. You need an emergency operation because of appendicitis, or something like that. You go, you get it fixed. You're done.
It's more of a short term, correct?
Yeah, it peaks.
Right.
It gets fixed.
Right.
And then you go back to normal.
Right.
Then the other care, the long-term care, usually, for most of us, occurs, in our older years, our later years. And that's when you need care every day. And a lot of times full-time, you need to be watched, you need to have assistance, you need to have health. And a lot of the people after they're age 65 are on Medicare. But Medicare is not part of the coverage for long-term care.
Yes.
So that leaves individuals to go one way or the other, provide it themselves because they bought it, they paid for it, whatever arrangements they made.
Sometimes people buy policies, long-term care policies, which are not that cheap, and sometimes coverage is a little not so good.
And there's wide variance on that. There are some that you buy all along. You starting when you're young and the payments are low, or you can wait till you're at a later age and even go for a one lump sum.
Yeah. So anybody who has insurance, they need to understand that it's an acute care plan, correct?
And it's a special policy.
Yes. It's not going to cover long-term care unless you've made other arrangements. Right. So please, this is like the essence of this first segment. Acute care versus long-term care. We will continue in the next segment to address acute care. Stay with us. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection, and I am your host, David Parra. We are addressing navigating healthcare from preventive to hospice. Love this title and love this subject. I think I always feel good when we cover this subject because I almost feel that just in the interactions that we have in the community, we understand that people are confused. And I mean, it's much needed. Before we continue, Suzanne, you wanted to add just a little bit more about the acute care concepts and versus long-term care. Go ahead.
Yes. Yeah. I just want to, make sure we clarify what exactly does that mean. So acute means, you're addressing a specific issue. So just like Ginny said, you go to the hospital for something. There's a reason behind it. Whereas the long-term aspect are those day-to-day care needs that can change,
Right.
but it may not constitute an acute or emergent need per se. So it's the long haul. It's the things that most of us deal with every day. Either ourselves, our families. We're helping our families. And family is a loose term. Family of origin, family, the people we choose to be in our life. So I feel like it's just so important to note that acute means you're going in for a specific reason. You're going to the doctor for something. And the long term is the long haul. It's all those changes that come in between that.
Right.
The way I describe it to my clients is if you need help with what we call ADLs, activities of daily living. So bathing, ambulating from one room to the next, cooking, things like that, Medicare doesn't cover, and that's considered long-term care. So you would need to purchase a long-term care policy, or if you are within the income guidelines and medical guidelines of Arizona long-term care, then that would be the option to take care of those long-term care needs.
Or if you have money, then you can pay cash as
Pay
well.
privately.
Right. Yeah.
Well, and that's what most of us deal with, especially in the Hispanic community. We're taking care of our own, and so we're helping. We're helping our grandparents, we're helping our parents, we're helping our aunts and uncles with those care needs, those activities of daily living. So,
Yes, and there is a concept of home and community-based services, and actually that's a budget item the government has to fund, because if it wasn't for family members who step in, the cost for caregiving would be astronomical.
Absolutely.
So let's continue to move to acute care. With the signing of the Affordable Care Act, the Affordable Care Act established 10 essential health benefits. The 10 essential health benefits is pretty much like the benefit packet that every plan, let me be very specific, acute care plan has to include. And I believe that I have a whole list, and because of time, I'm not going to read it, but that's going to be your hospital, your doctors, your specialists, your rehabilitation. What else? Prescription drugs. Okay, so that's going to be your basic, even care before and after a baby is born. What is that? Another term for that?
Prenatal care.
Prenatal care, etc. So that's going to be your benefits packet that an acute care, and we understand that you get it. You can get a plan with an individual from the individual market. You can get a plan with a marketplace. You can get a plan with your employer, which is called like group insurance. There's various ways to get your insurance. But the bottom line is that an acute care will have these 10 components. What I would like to ask you now is if a person is not sick, right? They bought their insurance. The first engagement, if you will, with healthcare will be preventive. So again, we're navigating. Can we talk about the preventive aspects of an acute care plan? And maybe we can start with Medicare, even though Medicare is for people 65. But what is there in the nature of preventive care under Medicare?
So there's a lot of services that are considered preventive, and it applies to all types of insurance, whether it's Medicare, Medicaid, private health insurance, or insurance through your employer. But with Medicare, for example, they cover 100% mammograms, diabetes screenings, glaucoma tests, any lung cancer tests. I have a whole list here, prostate cancer screenings, any screening to prevent a specific disease. For example, Medicare has a Welcome to Medicare exam, which you get the first 12 months of you being on Medicare. It's not a head-to-toe physical exam, but you basically talk to the doctor about your family history, and you develop a plan, a preventive plan. And after that, every year, they also cover at 100% the annual wellness visit, which is similar to the Welcome to Medicare exam, but you just update your record. And again, you talk about how to prevent certain diseases. If the doctor wants to order additional services, maybe lab work, then that would not be preventive. That would have a 20% coinsurance, but the actual visit would be 100% covered.
Got it. Yes.
So how do we educate those Medicare recipients to know going in, if they're going into that doctor's visit and saying, I want my welcome to Medicare visit, whatever that looks like, but then the doctor says, okay, well, let's just run these things and just make sure everything, that you're in tip-top shape. And most of us say, okay. And
Are
then,
you saying
and then
that
we
they
get a
can
bill.
do more perhaps, and then they're going to get billed as opposed to limiting themselves just to the welcome to Medicare
Right.
free
Yes,
exam?
exactly.
Yes.
So we
Okay.
hear free, and then
Right.
and of course the doctors are doing what they're supposed to
Right.
do, but the consumer may not know. Well, what do you mean I'm going to get a bill for that?
Right.
And I thought this
it's
was
all
free.
about education, and hopefully they reach us, the state health insurance program, and we educate them on
Perfect.
that, saying when you set up your appointment, make sure it's your welcome to Medicare visit, and be aware that if the doctor wants to order some other additional testing, that is not going to be covered at 100%. So it's all about education.
And I just wanted to add, so right now you're just talking about just straight Medicare, right? Not somebody that has Medicare Advantage. Just with my knowledge and history, I know that many seniors confuse that, like, oh, I have Medicare. And they're like, no, you have an Advantage plan. So that would change from plan to plan if they would go to an Advantage plan, these free services. Do you know?
It's still considered preventive. It might work a little bit differently. Contact the specific Advantage plan that your parent has, but the preventive service is covered at 100% by the Advantage plan as well.
Okay.
The Advantage plans are supposed to cover at the very least what original Medicare covers.
Okay.
They can offer more, but they cannot offer less.
Okay.
The other preventative care that I want to also talk about is a lot of people don't realize that in home health care, you can ask your doctor to write an order for home health. If you're needing some education in a chronic condition or medication management, or if you're falling or your mobility has decreased and you feel like you need physical therapy at home, you have to be homebound, but the doctor can write an order so that physical therapy and occupational therapy can come to your home and provide the therapy to help give you more strength to reduce your fall risk.
And that's still under the acute care, correct?
Yes, and it's covered by Medicare.
Okay, got it. Okay, and as we know, in another set of terminology that I think it's important, typically there's a concept of managed care. And with managed care, you have your HMOs, health maintenance organizations, and your PPOs. That's basically your more common types of managed care plans. Going back to Medicare is probably the only insurance that still provides the option of going with a nationwide network of providers. Right now, you hardly find that anymore. In managed care, in group insurance, you have a limited network of providers, whereas original Medicare gives you that option of going to any state of the country, any doctor you want. But with managed care, you always have a primary that has to manage your care.
Yes, with the original Medicare, I believe the figure is 97% around there of doctors accept original Medicare. And with the Advantage plan, if it's an HMO, you're locked into a network primarily in the county that you live in. So everything has to funnel through your PCP, your primary care doctor. You need referrals to see specialists, and they're the ones that are managing your Medicare benefits.
Let me see if I get this right, Martha. When you work in billing for 15 years, did you used to see bills coming to you or services to charge both in the inpatient and outpatient setting? Because this is another concept that is extremely important in navigating healthcare. You have your outpatient and your inpatient.
Right. So, I mean, you have, like you said, you have your outpatient and your inpatient services, and it all depends if you're in an HMO or a PPO, managed care
Right.
insurance, it's all going to be based on the referrals that you get and if you need like an authorization. So the patient might get a bill or they might not get a bill depending if the insurance is paying for that service. On the bill description, you would see if it's inpatient or outpatient
and
service.
Since I'm with you, Martha, what does the patient get? So you get a service that was provided. The insurance is going to be paying that. What does the patient get from the insurance? Because a lot of times they get confused with statements and versus invoices.
Right. So they would get what it's called an EOV, so explanation of benefits, and it's pretty much explaining to you what was done at your doctor's office. What did you get done? And it's really important for people to actually understand these explanation of benefits, because sometimes you could get overcharged. Even if you're not paying for this service, you could say, hey, I never got this. Why is my insurance getting charged for this? Right. And some people think it's a bill and they take it back to their doctor's office. Like, why do I need to pay for this? And it's, no, you're not. You don't need to pay for this. It's just letting you know what you got done. If you do have like a co-payment, then it will explain their patient responsibility, and that's the only part you would be responsible for. And again, if you feel like you're not responsible for that charge, then you need to call your insurance.
Yeah. Go ahead, Suzanne.
Yeah, I just want to really touch on that, really paying attention and looking at that explanation of benefits. I had a scenario. We took our daughter to an urgent care. Anyway, long story short, I received the bill, and it was a rather large bill. And I thought, something's not right here. And so, you need to do that homework. You need to do the digging. Be your best advocate, because, somebody could have easily paid an extra $400 that you didn't have to, because it may have been a billing error, which was the case in my scenario. So things like that happen all the time.
Did it came in the form of a statement or an actual invoice?
It came in the form of a statement. Okay. So because it was from an urgent care as opposed to,
All right, we will continue with this subject of navigating healthcare from preventive to hospice, emphasizing on acute care plans and concepts. Stay with us. This is AARP Arizona Hispanic Connection.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. The subject today, navigating healthcare from preventive to hospice. From preventive to hospice. And again, we have to go quick because there's so much to cover. And I want to say that this is going to be just the first one. We will have to continue to address healthcare, navigating the system in future shows. You can count on that because this is such an important need. Before we transition to long-term care, which I really want us to devote a lot of time on that, in home health care, hospice, nursing homes and all that, skilled nursing. I wanted to come back to you, Andrea, and ask you, there is a big difference in inpatient and outpatient if you are a Medicare beneficiary. Actually, bottom line, there is a big difference, but it's very, very marked on Medicare.
Yes, so most of us are aware that outpatient means when you go to the doctor, you get lab work, you need a wheelchair, diabetic supplies. That's considered outpatient. You're not receiving it at a hospital. But the other issue is that even if you are hospitalized, if you go into the hospital, you could be considered outpatient. Usually what I tell my clients is, if the doctors don't really know what is wrong and they're doing a lot of testing, that means you're under observation, and that will mean that Medicare Part B, as in boy, will cover everything that happened during observation. Later on, the doctor deems that you need to be admitted as an inpatient, then Part A covers from that day forward. And this is very crucial because, again, the part of Medicare determines how much the patient will be responsible for if someone's under observation or inpatient. If someone's inpatient, the deductible is about $1,340, whereas Part B, the beneficiary will pay 20% of every single service, and that could be thousands of dollars. So it's very important to understand that just because you're in the hospital and you spend the night or 2 nights doesn't mean you're inpatient. You could still be outpatient.
In the end, the amount that you are going to pay is going to be different, and that's why it is so critical to understand these concepts if you're going to be in an inpatient status as opposed to outpatient.
So not only the cost, but it will also affect your skilled nursing facility care.
That's important. What is the requirement for somebody to be on Medicare? This is only on Medicare to be eligible for skilled nursing care.
So the
Medicare.
beneficiary has to be admitted as an inpatient for 3 midnights.
Right.
So if you're the first night, you're under observation, and then the second and third night, you're inpatient, and you get released on that third day, you are not eligible for skilled nursing facility care.
So if you needed it, you're going to be on your own.
You
much.
have to pay 100%.
That is
So
amazing.
it's crucial to maybe, obviously the patient's not aware they're sick. They're in the hospital for a reason, but talk to a family member, maybe a spouse, so they could be aware of this inpatient versus outpatient situation.
Perfect. And that's why I say that we have to do more shows on this. Dr. Krieger, sorry?
When you are at the hospital or you have someone that you took to the hospital, never, ever be afraid to ask, is this an admission? It all stands on that word. Am I admitted? And they will answer yes or no. You want to know the point at which you're admitted.
And
At
as an
that
inpatient,
point,
make sure they say inpatient.
admitted as into the hospital,
Right.
as inpatient.
And that's
Be
by
sure
a
and
doctor's
ask it.
order. I think a
That's
doctor's
correct.
order will trigger that.
And then you know that your coverage has started the way that you wanted it to be.
Perfect. Okay, obviously, this is not justice to acute care, right? But we just wanted to introduce the subject, and we're going to have shows on more details. But let's transition. Jamie, help us understand the scenario that allows a person's care to transition from acute to long-term. What is it? What triggers that an insurance company says, oops, sorry, this care is no longer under acute. It's moving on long-term, and we don't cover that. What is that scenario, if you can help us understand it?
Yeah, so sometimes people are discharged from the hospital directly to home. If they don't qualify for going to a rehab facility, when they get home, they may need care at home. And if they have family members that can pitch in and help, that's great. But many people don't have family members that can help, so they need long-term care. So that's needing assistance with activities of daily living.
Such as
Bathing, dressing, ambulating, transferring, toileting, eating, and then those are activities of daily living. And then the IADLs, which are independent activities of daily living, cooking, cleaning, preparing meals, going grocery shopping, running errands, going back to see the doctor. So those are all under long-term care.
Mm-hmm.
And so if an individual does not have long-term care insurance policy, it's out-of-pocket cost for them.
Wow.
Unless they are a veteran that has served during wartime, then they may qualify for the VA aid and attendance.
Mm-hmm.
Or, again, we talked earlier about the Arizona long-term care, which do provide assistance with activities of daily living if they qualify both medically and financially.
Mm-hmm.
I do want to point out that if you have a family member, if you qualify for Arizona long-term care and you have a family member who wants to step up and be that family caregiver, they can be paid to be that family caregiver. They have to be trained to become a direct care worker through an agency that is contracted with Altex.
And that training, does it involve certification or just for the needs of that person?
Yeah,
particularly?
unfortunately, it's not a certification training, but they'll be trained and tested, and then their information will be put on the Access database for direct care workers.
So that's what triggers the care, from acute to long-term care. So now let's say that a person has moved into that kind of care. If a person, Jeannie, had purchased a long-term care policy, I assume they can tap into that, or they can pay cash if they don't. Or if they then at that point, if they qualify based on income, they would have to apply for Altix, correct?
Okay, some people have purchased their long-term care beginning when they were younger.
Mm-hmm.
So then they simply, reread the plan or call their agent or whatever, and then revisit their coverage.
So am I to assume that then that policy will basically just pay for the services that an agency will provide? Is that how it would work?
Yeah, sometimes there are limits. Sometimes there's a dollar amount. Sometimes the charge exceeds what's available.
Mm-hmm.
So that's why I say talk to the agent and reread your plan.
So once the needs, right, have transitioned from acute coverage, so to speak, to long-term care, right, because of your daily needs. Now that moves into the long-term care arena. Jamie, if you can help us understand, what are the scenarios, the different ways, options that perhaps a person will be available for the patient? Is it services at home? Is it where do the nursing home come in? Where does the home group homes come in, et cetera, et cetera?
Yes. Most people want to remain at home for as long as possible because that's where their heart is. And we want to keep them at home for as long as possible with a little bit of attendant care services. But for some people, they may reach a point where they really are not safe at home because they need 24/7 care, and it's really not affordable for them to have care at home. So at that point, they're given the option to either get a lot of care at home or move into assisted living. And in assisted living, you have several choices. You have group homes that can take up to 5 or 10 residents in a group home, or you can go into assisted living facilities or a memory care facility. So those are your choices for long-term care.
So you can have the doctor order some services at home. That situation may be one that forces you to go to a group home or assisted living facility. Is that the same? Is that like the facilities like as opposed to independent living, assisted living facilities, and then they just have a section that deals with long-term care?
Yes. I mean, there are some they call CCRC, continuing care. Where they start out in independent living where they're just needing a little bit of in independent living, they're not getting any care at all, but, they can go down for meals and they can have socialization, different activities. But when they get to a point where they need care, then they can move into assisted living and they can get different levels of care.
And this is the kind of care not covered by an acute care plan.
That's correct.
And it is very expensive, right?
Yes.
Very expensive. That's where if you don't have a policy. Ginny, we have about a minute and a half, and you have your husband and your mother in one of these centers. Would you share some of the experiences?
Yes,
go ahead.
There's a space, a little notch right before Jamie's talking about assisted living. That's called independent living. And the people who are not having trouble with their daily living, the grooming, the bathing, the toileting, any of that, not having trouble with it. But they can no longer stay in their home because there's the lawn, there's the yard, there's the this, there's the that. And they don't want to live with their children, like my mother doesn't want to live with anyone. She went into independent living, and that still is a pretty reasonable cost. My husband, on the other hand, does have challenges with daily living. And so he's in the same facility, but a different portion of the facility.
Very interesting.
Okay,
independent living on the one hand for your mother, and then assisted living.
At about half the price of my husband, who needs assisted plus memory unit.
We have to go on our last break. Time flies. And again, we're just kind of doing an introductory show. We definitely have to elaborate more on upcoming shows. Thank you for staying with us. This is AARP Arizona Hispanic Connection. We'll be right back.
Welcome to AARP Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you for staying with us. This is AARP, Arizona Hispanic Connection, navigating healthcare from preventive to hospice. And indeed, this show has given lots of information about how complex healthcare is, and we definitely need a navigator, right? And it's interesting. We all have parents or someone that we're helping, and I just without help, it would just be impossible for our parents to deal with this. This is always changing. I do not want to run out of time without addressing hospice. Okay, this is a super important issue, and at some point, when a person comes to a point where a doctor basically says this person it has 6 months to live. And it doesn't mean that it's going to happen like that, but it's just a diagnosis, if you will. I give this person 6 months to live. That kind of triggers hospice. And by the way, hospice is covered under Medicare. But I would like to come back to you, Suzanne, because you work for Hospice of the Valley, and there are many companies that provide hospice. But I think you are the nonprofit, if I remember right. So take it away. Educate us and everyone on hospice.
Absolutely. Thank you. And it is a very important topic. Oftentimes people hear hospice and they think, oh, nope, I'm not ready for that. No, I don't need that yet. And people hear hospice and think that means you're going to pass away in the next week. And does that happen sometimes? Yes. But typically that's not the case. And that's why we try to get in there sooner rather than later, because there is so much support that hospice can provide. And like you said, there are I think at last count, over 80 or 85 hospices just in Maricopa County. So, and they're not all the same. Of course, I'm here, representing Hospice of the Valley. I think that I know that we're the best. We are a not-for-profit. So that means you will never receive a bill for hospice services if you need them, regardless of if you have Medicare, if you have another insurance. Unfortunately, cancer doesn't discriminate, and dementia, we're seeing it earlier and earlier. Heart diseases, all sorts of things are out there, and you don't have to be 65 or 55 plus to get them. And we feel very strongly that, especially at this point in your life, the last thing you need to be worrying about is a bill that you're receiving for services. So hospice,
obviously it's care.
Yes.
It's called hospice care.
Yes.
What is that care?
So hospice is it's an interdisciplinary team approach. So you have a registered nurse case manager, you have the support of a social worker, you have the support of a chaplain if that's something that you desire, you have the support of a certified nursing assistant, and that's somebody who comes in and helps with those bathing needs that we were talking about, those activities of daily living. And again, it's all we approach it mind, body, and spirit, because somebody may be having pain, but it may not be physical pain. It may be emotional pain, and that can be something that our social workers can help address, along with all the other physical components of whatever that diagnosis is.
So at that time, I understand that the doctors are no longer treating the condition, correct?
Well, the doctors say, you know what, there's not much else we can do. At this point, I would suggest end of life or hospice care. And the majority of the time, 90% of our services are in the home. So it's wherever that person lives. They may live in their own home. They may live in independent living. They may live with a family member, whatever it may be, a senior apartment, whatever it might be, we go to where you are. It's not a place hospice is not a place to go.
That is a good thing to explain. So hospice is not a place, it's a type of service, correct? And it can be done in different settings.
Yep, it's an approach to care, and it's a mindset. So we very much want to see somebody live their best quality of life for however long they have. It's about living. It's not about dying.
Right. And so again, typically an insurance company like Medicare will pay for that. Would you say that most of the people that you serve are Medicare?
Yes, most of them. However, last year I want to say I believe we donated. It was over $1 million in care to folks who needed it. So that could have meant they didn't have insurance coverage, whatever the scenario was. And again, that's because we are a not-for-profit, and we feel strongly that if the community needs it, we will provide it.
Yeah, I still want to force you, sorry, to be more specific. They're not treating the condition anymore. What is that?
So at that point, we're talking comfort care.
Right.
So we're looking at somebody had, let's just use cancer as a diagnosis. So if somebody has cancer and the doctor said, you know what, the chemotherapy's not working anymore. The injections aren't working anymore. The radiation's not working anymore. There's not much else we can do. Hospice comes in and provides comfort care. Okay. So we are treating your pain. We're treating whatever other things or issues that may be going on, but from a comfort approach.
Right.
So we're not going to do aggressive measures. We're not going to be doing labs. We're not going to be taking blood. Typically speaking, we're not going to be doing that because, we want you to be comfortable. Right. And most of the time, that's not comfortable.
And sometimes people's condition improve, I understand, and then they move out of hospice, right?
Yes, which is wonderful. We call it graduating.
Good.
And we're all for that. There's two ways off hospice.
Right.
And oftentimes it is because you have the consistency. You have a nurse coming in 2 to 3 times a week and monitoring the medications you're taking. And oftentimes it's because there are so many medications somebody has had because not everybody is communicating. Not all the doctors or providers have been communicating with one another. We come in and see, wow, there's a lot going on here. We can minimize things and people feel better, which is great. That's what we want. We want people to feel better, to live their best life, to get out and go to lunches and to go shopping and to do all those things that they want to do.
Perfect.
Again, it's about living.
Perfect. Coming back, go ahead before I ask you another question. Go ahead.
And we partner a lot with hospice agencies because a lot of people, they think once they are on hospice, all the care will be provided. I mean, there are a lot of care and support. However, they're not there 24/7. So we get a lot of referrals from hospice agencies for home care services because our caregivers can be in the home longer periods of time to help the family, offer respite care so that the family member can get a good night's sleep. While somebody is right there by the bedside caring for their loved ones.
Yep, that's a great point.
Go ahead, Martha.
And in that case, if you get a referral from hospice or, not Hospice of the Valley, but a hospice provider, does that care get taken care of? Like, does Medicare or any insurance pay for that person, or it goes back to non-payment for that?
Yeah, again, Medicare does not cover. It covers hospice care, but that is still considered attendant care services that does not get covered.
And that's where a nonprofit such as hospice come in, right?
Right, but we still, Hospice of the Valley, we provide intermittent care. So just like Jamie had mentioned, we are not able to be there all day or all night, but we do have staff available all day and all night. So if you call us at 3 o'clock in the morning, because, emergencies don't happen 9 to 5, Monday through Friday. They happen at 2 in the morning or on Sunday at, midnight. So whenever you call Hospice of the Valley's phone number, you will talk to an actual person. You're not waking somebody up. You're not interrupting anybody. It's not anybody on call. That's somebody's set shift who is working. And if you need somebody to come out, we'll come out.
Perfect.
Well, a lot of times hospice care is described as comfort care. And actually you can get hospice even in the hospital. You can get it even in the hospital. And sometimes when it looks like death is imminent, they can simply go to another floor where that unit is available and they get hospice. So hospice comes to the patient. And that can be in the hospital or in assisted living or in whatever kind of situation they're in. So you got to remember that. So the hospice is not the part that's the facility you live in.
Right.
Okay, you're providing that with whatever arrangements you've been able to make. By you making rental payments or to a facility or so on and so forth. But it will come to you, and it's not 24 hours a day there. But if you are eligible for it, you will be able to get it under your Medicare.
Perfect. We just have a couple more minutes. Jamie, so somebody can have access, and then at some point they can add the Altex to the access, correct?
Absolutely. Yes.
So someone is in access, and then they come to a point where they need long-term care, and they qualify, and then they add that component to the access program. So in most cases, they'll be getting their long-term care services, but then they may go back into an acute care also, correct?
Most of the time, if they qualify for long-term care, so you have to submit a different application for long-term care.
Right.
But once they qualify for long-term care, they're pretty much on long-term care for the rest of their life.
Got it. Got it.
Because they are needing assistance of activities of daily living.
And really quick, because we're running out of time. So Access, the Arizona Healthcare Cost Containment System here in Arizona, contracts with insurance companies to provide the Access benefit packet, and with other insurance companies to provide the Altex benefits packet. And then each insurance work with home healthcare providers, correct?
That's correct.
So it's a kind of a chain of,
Yes.
of providers that the government agency contracts with. Real quick, Suzanne.
And I just wanted to note that Hospice of the Valley is provided in conjunction with any of those other programs. So if somebody is on Access, if somebody is on Altex, Arizona Long-Term Care System, Hospice of the Valley still comes in and provides care. It's just sort of an added layer of support. Nothing would change with their insurance.
When a person qualifies for Access, I mean, if you're thinking that your loved one is going to need to qualify for Altex, please be sure that when you're looking for a facility for them to live in, that they accept Altex payments.
Yes.
Okay, you can't just go to the location of your choice. You have to make that choice based on the facilities that have it available.
Right. Very, very good. Okay, I tell you what. Let's conclude this show. I am happy with this show. I think we accomplished what we wanted to do. Is basically introduce all kinds of concepts that involve the healthcare system, and we have no choice but to learn to navigate. We have about 45 seconds. Final thoughts, final words. Anybody, go ahead.
Again, I just think the biggest thing is advocating for yourself as best as you possibly can. And there are so many agencies out there that want to help, Hospice of the Valley being one of them. So don't ever hesitate to call and to reach out. That's what we are there for. Hospice of the Valley has a separate Spanish line as well for folks who only speak Spanish, if that is helpful and needed as well.
Good.
And the same with the State Health Insurance Assistance Program. For any Medicare beneficiary, we help with everything related to Medicare. So I'll give our number. So if anyone wants to reach us, you can. It's 800-432-4040. Again, 800-432-4040. And again, we provide free, unbiased Medicare counseling.
There's really no wrong door. Just call somebody and you'll find help. I want to thank each one of you for making time. I know it's early morning that we have to have you here, and I appreciate that very, very much. Thank you. And we really hope you enjoy this show, Navigating Healthcare from Preventive to Hospice. This was AARP Arizona Hispanic Connection. Have a great week.